Good morning, everyone. My name is Haley Volker, and today I will be speaking to you about diabetes. More than 37 million people, or 11.3% of the U.S. population, have been diagnosed with diabetes or prediabetes, per the CDC January 2022, the National Diabetes Statistics Report. It is the seventh leading cause of death in the United States. It is a chronic disease that affects how your body processes sugar, as well as affects your life in many other ways. Your cells need this sugar for energy, but too much can be a bad thing if it's not regulated. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Per the NIDDK, July 2017, what is diabetes? Glucose, or sugar, is very important in our bodies. Our muscles, brain, cells, along with many other systems, use glucose. When there's too much sugar in the bloodstream, your body sends a signal to your pancreas to create insulin. Some people's bodies cannot produce this insulin, which is called type 1 diabetes. It is normally diagnosed in the earlier years, which is why it's called juvenile diabetes. Type 2 diabetes is when cells cannot absorb the insulin that is made, and is called insulin resistance. It is the most common form of diabetes. There's also another type called gestational diabetes, which women can get during pregnancy. Signs and symptoms of diabetes can be minor. Some people do not know that they have this and can live with it for years until symptoms finally do show, or doctor visits show elevated glucose levels. Some signs and symptoms of diabetes include extreme thirst, which is mentioned in the Philip interview, frequent urination, blurry vision, tingling in the hands or feet, acquiring more infections than normal that are hard to get rid of, and extreme tiredness or fatigue. It is very important to manage your diabetes. Some people require medications such as metformin or glipizide to help regulate blood sugars. Some people also require insulin, which can be given at meal times or at bedtime. Checking blood sugars on a regular basis to make sure your levels are in range that are normally set by your doctor are very important. Technology has changed the medical world in more ways than one. There are new monitors that diabetics can stick into fatty portions of their body, such as abdomen or arms, with a small needle, but then simply scan their phone on it to check their blood sugar. And this is as opposed to the normal way or old way of doing it, where you use a tiny device with a needle to prick your finger and use a device called a glucometer to put that blood in to test the blood sugar. Changing your lifestyle and cutting out fatty and sugary foods, as well as exercise, is important. With consistent exercise and healthy meals, some people can manage diabetes without the use of medications or insulins. They just need routine follow-up appointments and lab work from their doctors. Diabetes can be much more than just elevated blood sugar. It affects many systems in our body, and you can also have predisposing factors. Complications of diabetes include, but are not limited to, cardiovascular disease, neuropathy, which is damage to the nerves that causes weakness, pain, and numbness, nephropathy, which is kidney disease, and retinopathy, a disease of the retinas. Predisposing factors of diabetes include family history of diabetes, age, weight, race, having a diagnosis of high blood pressure, depression, and lifestyle. Diabetes is a common disease that affects much of the U.S. population. While there is no cure for diabetes, lifestyle changes can help manage this disease. Learning how to prevent certain types of diabetes is very important. Some people may think having diabetes is not bad, but understanding what the disease is and what it can do to your body is very imperative. In conclusion, I think that staying healthy should always be your main goal. Thank you so much for listening to me, and have a great day.